Yes, like people walk out of our clinic crying because they're so like grateful that we're here and that we're helping them finally. It feels good. It brings me back to like when my mom raised me. She raised me to actually be able to help people, and we come here so close to Mexico. Everyone speaks Spanish. We get about on average 5 people a day that speak English. So I actually communicate with them and know how they are feeling and what's hurting them. So it feels really good.
Near the Texas-Mexico border in Edinburg, Texas, the 7235th Medical Support Unit has come from Orlando, Florida, armed with medical professionals to combat medical issues that stand in the way of healthier living. For 10 days, residents from Hidalgo County flocked to 2 public schools, Harwell Middle School and William Jefferson Clinton Elementary, to receive needed health care services at the skilled hands of U.S. Army Reserve medical professionals. The dental, medical, and optical services provided are part of the Department of Defense's Innovative Readiness Training, or IRT program, which focuses on community needs such as infrastructure, healthcare, transportation, and cybersecurity. The medical requirements for this community align with the Army Reserve Medical Command's Mission Essential Training requirements to ensure combat readiness for its units, providing the medical community the opportunity to work together as a team with a diverse patient population, which also enhances individual soldier skills.
So every time we do go to annual training, we'll get some training. We're not doing it in the civilian side. You know, you kind of forget a little bit about the things you do. So it definitely makes you a better person by learning and progressing in something that's not normally what you do in the civilian side.
The soldiers had many community volunteers who provided translation assistance and acted as patient guides to help them get to the various stations. The most popular station was the dental van, where many people had their teeth pulled, cleaned, or cavities filled. It was the most needed service among the local population.
Yes, last year, and also in another health fair that she had gone through, they had told her that she had cavities on her molars, and she waited until today to come and get the molars extracted.
People waited for hours for the dentist, but they were all eventually treated by Army Reserve dentists who practiced dentistry full-time when not working on an Army mission like this one. For some of the patients, the dentist service was a big, positive quality of life change.
People coming here who have never seen dentists, assistants, they haven't really seen any medical care whatsoever, and it's pretty impressive, especially small children, kids that probably, if it's the first time sitting in a dental chair, some of them are scared, nervous, but you know, when you create a nice, calm environment for them, they're able to sit down and actually feel good about it. They get their teeth clean, teach them a little bit of education, how to clean their teeth, and maybe pull a teeth or two, and it's just a different, life-changing for them.
One patient came to see the doctor because her prescription was too expensive and she could not afford it anymore. Education was the key to her surprise success.
They were on a medication, and I was going to write a script for the medication, and I found out that that medication cost $400 from one of the physicians here. So we changed the medication to a $4 medication, and now she can go fill the medication where she said she would have never filled the medication. So I think we're educating them on what they can get instead of not getting any care, any medications, and living with these diseases untreated.
Eye exams, prescriptions, and local connections for new glasses and follow-on care were offered to patients needing optical services. Patients, be they young or old, hadn't seen an optometrist for years or ever, and may not have realized that they needed glasses. This happened to Captain Evan Stute as a kid, who grew up not knowing he was missing life's details he could not see.
I had the pretty classic put on the glasses for the first time, and you can see the leaves on the trees now and things that you didn't know were there before. So I hope that we've changed lives. I hope that we've changed people's ability to just perform everyday tasks and function and live better in their lives.
To be able to take care of folks in our own backyard and see the absolute need is truly an eye-opener for the younger soldiers. But we do recognize that there is a true need here in the United States to continue IRT missions.
In the end, as soldiers packed up to leave Edinburg, they could feel good that more than 1,125 people in the area received nearly 1,900 medical services collectively in the 10-day period. Reporting from Edinburg, Texas, for Army Reserve Medical Command, I'm Sergeant First Class Kenny Scott.